So here we are at the Global Health and Education Consortium in Cuernavaca, Mexico, and I will be asking Dr. Thomas Novotny a few questions about his various work, especially related to the field of global health diplomacy. So the private healthcare, the private sector, non-governmental organizations, scientists, the media, they're all major players in global health diplomacy. Do you have any advice for students on how we can better understand the interactions between all these major players and how important these interactions are?
Well, it's pretty difficult because it is complex, and it's not easily done in a classroom where you have somebody standing up in front of people who are not, familiar with all of these multiple organizations and reading off a list of them or a bunch of alphabet soup acronyms that don't mean anything. So that's not the best way, but the complexity of global health is something that increases exponentially almost every year. New donors, governments have different kind of roles to play. The private sector has enormous influence, whether it's through pharmaceuticals or through other kind of medical technologies, and philanthropy for sure. And so it is difficult to get a good handle on this stuff, and there's many things written, but not all of them are really very illuminating. So I guess the best advice I have is to be able to do as much kind of background reading. There's lots of books published about how the World Bank works, for instance. There are historical documents about how the WHO and multinational organizations are set up. There's critiques of the donor activities and certainly of places like USAID and CETA and DANITA and DFID and all of these other multinational donor organizations. But really the best way to learn about them is to go do it. And that is internships, exposures and other kinds of ways, being able to work with faculty members that perhaps have had direct experience in that way. But it is difficult to do this in a sort of classroom setting. There would be nothing more interesting than being able to attend the World Health Assembly. It's not that easy to do, but it's something that in order to understand what the WHO does, that would be one beautiful way of doing it. So you have to be there.
And so you don't think it should be taught in a class with a lecturer listing things, but do you think it should be a concrete, integral part of the curriculum of students? Yeah, I'm not saying that it shouldn't be part of classwork, but I think the way it should be learned is not through sort of rote memorization of organizations, because that's first of all, that's going to change from year to year, but through case studies, problem solving, problem-based learning, where let's say there's a challenge like H1N1. What was the multinational response? What was the response of the pharmaceutical industry? What did governments do to either take care of their own population or to help with others? And what were the sort of global governance structures that were implicated in that response? So those things become quite useful case studies, especially if they're with contemporaneous global health problems that are happening right now. I mean, it's useful to go back and look at things like the eradication of smallpox. That was a big deal, and it was something that was important to learn about and still is. But it's more meaningful if you can kind of get contemporary case studies, see what's going on, and now it's much easier with the information that's available online and basically real-time kind of monitoring of epidemics. So right now, with the increasing globalization, with the situation of the power shift in global health diplomacy in Brazil, do you have any particular predictions for the North American countries like the US and Canada?
Well, Brazil is an interesting case. They first of all have a very professionalized diplomatic corps where their diplomats are lifelong trained, highly skilled negotiators. They're oftentimes called upon to, for instance, supervise or lead the negotiations on things like disarmament on a multinational level. And the Framework Convention on Tobacco Control was led by a Brazilian diplomat who's now the Minister of Foreign Affairs. And so there's some good examples there. The other thing about Brazil is that they have a pretty good record of policy consistency, meaning that they have a constitution that guarantees certain rights to their people, but they not only believe in that in terms of health care rights for their people and access to medications, etc., but they not only believe in that as their domestic responsibility, but also as something that they want to project internationally or globally. And so they've often taken a leadership position, especially when it revolves around issues important to the global south. And so they've taken a pretty strong stand in defending what they believe in for their domestic kind of health priorities that is consistent with their international priorities, international face of involvement, especially as a leader of the global south. So that's an interesting lesson. The U.S. has about 40 different agencies that do global health. Very, very disaggregated, difficult to coordinate, and chaotic in many ways. Canada is much better. Canada has had a good record of, I think, policy consistency. They have a healthcare system that makes an assertion about the rights of people to health care. The U.S. doesn't have that kind of health system and still doesn't, even with the health insurance reform that we have. And so, there's something to learn there, and I think that's the lesson. Brazil joined with 6 other ministers of foreign affairs meeting to say that health is part of our foreign policy. So that's something I think that the U.S. is getting and has been expressed in the Institute of Medicine and other publications that says, yeah, I mean, health is a pillar of foreign policy. We can find areas of common ground, not just with the developing world, not just as a donor, but as a necessity for peace, stability, and economic development globally, which should be a pretty visible priority for U.S. and Canadian foreign policy as well.
And you also spoke about Brazil, well, every country shifting from a more international view of health to a more global view of health. And you wrote about that in your article as well. Can you explain that a little more?
I think people are finally getting the concept of what global health is. It's not something one country does to another. It's not some sort of missionary medicine activity, but it's actually a collaborative effort at improving health, not just for a sovereign nation, but as a collective responsibility. And I think especially in the healthcare profession, people get that. It's pretty clear. I think in foreign policy and international affairs, they're starting to get that. And that I think what we're missing is the junction of these two sort of professional concerns. Health people don't necessarily know or understand how negotiations and foreign policy work, and foreign policy people know how negotiations work, but their point is to usually in diplomacy to get somebody to think along your lines or to do what you think they should be doing for your benefit. But really health diplomacy and this global health concept means that we all have to work together for the good of our sovereign populations as well as the global public good. So I think that there's a continuing shift from this sense of international health as just a bilateral relationship of assistance to a collaborative relationship that the low middle income countries and the high income countries have a mutual responsibility for.
And if there's just one thing that you could say that, like, for each and every person that attends this conference to take home about global health diplomacy, whether it be something they can do concretely or whether it be discussing certain things or reading up on certain things, what would your main...
Gain experience. I think, there's a lot of ways to do that, whether it's through internships or opportunities and with multinational organizations, government organizations. Those kinds of things are very, very useful. I think, again, being there, experiencing what people are involved in directly is the main thing. It helps to beef up your learning with a lot of the books and literature that are out there on many of the things we've been talking about, and to take advantage of learning experiences that go beyond medicine. Now, it's difficult in medical school because you've got plenty of responsibilities for learning, but beyond that, I think the issues of economics, political science, law, and global governance you can get additional learning experiences perhaps outside of health learning. And I think the other piece is that I think everybody in the health professions should look for some opportunity for public service, whether it's a month or 2 years or something. Those experiences give you a sense of how decisions may be made and what the implications of the decisions are in more clinical settings even.
Thank you very much, Dr. Novotny.
You're welcome. It's a pleasure.